Hi, my name is Keith Barnaby. I'm a harm reduction specialist for a company called AIDS Project Worcester. For those of you who don't know about AIDS Project Worcester, we're out in Worcester area, 85 Green Street. It's a nonprofit organization that's been around since 1987. We started back in 87 working with the community with HIV and AIDS, and today we've expanded way beyond that to include working with populations such as homelessness and substance use disorders. My specific role there is to have a pilot program called OEND, which is funded by the Department of Public Health. What OEND stands for is Overdose Education Narcan Distribution, and my primary focus is North Worcester County. As being a longtime resident in North Worcester County, it's my privilege to work in the area and serve this community. What I would do on a daily basis is go out to a lot of these places, the sober homes, all the halfway houses, a lot of MAT programs, that's medicated assisted treatment, specifically the methadone programs in the area, the sheriff's program. I'll do the drop-in centers, recovery centers. There's really nowhere I won't go and do an overdose training, teach people what to do in an overdose, and more importantly, put Narcan in people's hands. It's all funded by the Department of Public Health. My Narcan is free, and I have no problem distributing it across North Worcester County and anywhere to save lives. We've been doing this since 2011. There's over 3,000 folks that their lives have been saved due to Narcan that we've distributed in this area. Narcan saves lives. This year is 2020, and if you find yourself or a family member or a loved one or friend in the grips of addiction, we need to have Narcan right away. Narcan is going to save lives. The end of the day, we deal in harm reduction. I'm trying to keep folks alive out here because I truly believe that everybody can recover from this disease. The problem is I just don't know how or when it's going to happen for a particular individual. But until it does, can I keep that person alive? And that's why I'm very passionate about what I do, and I believe that everybody should have Narcan in their hands. At the end of this, I'm going to show you how to get Narcan. If you need it today, it's all free. I got places all throughout North Worcester County that distribute Narcan for us, so you'll be able to find out where to go get Narcan. Some of the other services that we provide out there at AIDS Project Worcester, also known as APW, we have a syringe service program where we'll actually distribute syringes out in the Worcester County along with clean equipment. And when I mention this to a lot of folks, sometimes I get mixed reviews on that. And they say, geez, what are you doing? Are you handing out needles everywhere? Are you enabling folks to use? And the answer to that question is quite simple. The answer is no. I'm not trying to enable anybody. I don't have the kind of power to stop somebody from using today. I just can't do that. But what I can do is give them a safer way to do that. And what that does is creates a relationship, a bond. This addiction drives folks into the shadows, and they come right to our drop-in center 5 days a week to get their equipment. But at the same time, we have that interaction, and we begin to build that rapport or that relationship with those folks. And they know they can count on us to keep them safe. And over time, if they do need that help, they know that we're here to help them. So it's creating that relationship with the folks and also keeping them safe. We don't need people using the same needle over and over again. We don't need them sharing needles. We also do testing at APW. We test for HIV, STDs. Currently, right now, that is suspended due to COVID, but right now we're doing COVID testing out in Marlborough and Worcester areas. So some of the other services we provide, and I'm going to give you some information at the end that's going to show you how to access some of those services here today. All right, so today the purpose of this video is really to teach folks on what to do in an overdose, how to respond, and how to respond quickly, because time is of the essence in every single overdose. We don't want to lose anybody out here. So I'm going to teach you, first I'm going to talk about the drugs. Let's talk about what's out there for drugs and what's going on, how the people are using drugs out here today. What's actually happening in an overdose. I think if you have a better understanding of what's happening in an overdose, you're better equipped to better handle that overdose if you find yourself in that situation. So I'm going to try to teach you how to quickly assess an overdose, and then what we're going to do with or without Narcan. I'm going to cover you a couple of different scenarios on there. We're also going to address COVID. Because things have kind of changed now that COVID's here. And I'm going to talk about that, rescue breathing versus chest compressions, and each situation, each scenario, and which way we should probably go. And at the end, like I said, we're going to give you all kinds of information as far as phone numbers, places to call, places to go to get Narcan here today. So the best way to learn how to respond to an overdose, I think, is first start talking about the drugs. Let's talk about the drugs today. And really, we're talking primarily about opiates here. We got three categories of opiates. We have a natural opiates. Two examples of a natural opiate is going to be your morphine and your codeine. After you get out of the natural category of opiates, you get into a semi-synthetic opiate. And that's going to be, when you hear the word synthetic, I want you to think man-made. Man played a part in this. So a semi-synthetic category, a couple examples, Percocet, Vicodin, heroin is a semi-synthetic opiate. And then we have a category called full synthetic opiates. Two examples of that is going to be methadone, and the word on the street today is fentanyl. Fentanyl is sometimes known on the street as Fetty. It's prevalent, and about 93% of every overdose that occurs is fentanyl related. And I think you're going to see that number continue to climb. It's up to 100 times stronger than heroin. The strength on the streets is unknown, and it's often mixed with other drugs, specifically cocaine. Cocaine is added to fentanyl because it's going to increase that initial rush for that particular user. But fentanyl is a very, very, very powerful drug, very strong out here. And the problem really is when you're buying these drugs on the streets, these drug dealers have almost become scientists and chemists in a way, and they're mixing these at street level. And they really have no idea how strong a batch can be, and they can vary from batch to batch. So the consumer on the street buying these really has no idea what's in there or how strong that is. And that's what makes this very, very dangerous. So there's lots of ways that folks can use the drugs out here today. We call it the 4 S's. They can shoot it, smoke it, snort it, swallow it. Any which one of these ways can lead to an overdose. Please don't think you're safer because you don't inject. I spent 4 years working in a methadone program with hundreds and hundreds of clients, and I have clients come in and say, you know, Keith, I just snort a little bit. I don't have to worry about overdose. This is a myth. I have lost people to every single one of these methods of overdose. It does not matter which way you choose. You are at risk of an overdose. I think it's important to remember. So what is really happening in an overdose? No matter which way these folks try to use those drugs, what's actually going to happen is those opiate molecules are going to travel to their brain. Okay, and in our brain we have all these little receptors. They're actually called opioid receptors, and those opiate molecules are going to travel to that receptor and bind to it, and that's what's going to give that person the desired effect. It can happen very, very rapidly. The problem with that is that those receptors have a lot of functions, but one of their primary functions that they hold in the human body is that they control your respiratory system. So if you take too much of that drug, or maybe it's just a very small amount, but it's a very, very strong batch, you can instantly start to suppress your respiratory system. And that's going to be a lack of oxygen. And we all know a lack of oxygen, bad things are going to happen. Some of the top risk factors of an overdose. All right, number one top risk factor is tolerance. Another risk factor is going to be your prior overdoses and polysubstance. I'm going to talk about each one of those real quick. Tolerance, that's the number one risk factor. And again, daily users develop a very high tolerance, but if they stop using just for 2 days, they can lower their tolerance level, and it puts them at a high risk for an overdose. Those folks coming out of incarceration is very, very high risk population. Really, they've taken a break from the drug, abstinence, and they're coming out, and if they pick up right where they left off, it's very likely they're going to have an overdose because their body cannot tolerate that drug because they haven't used it in a certain amount of time. Those folks in medicated assisted treatments, just starting in a methadone or Suboxone, very, very high risk. We have to keep a close eye on those folks out there because they're trying to stop using that drug, so they're lowering their tolerance. But, as we all know, trying to go into recovery early, sometimes there's a lot of struggles there. And if they do pick up, it's a very, very high risk. And those individuals, obviously, in early recovery, it's really near and dear to my heart that we get into these halfway houses and these sober homes. There's nothing more disheartening to me is when I have guys and girls out in this community right here that are entering programs, putting in an effort, trying to change their life. And because on one day they made one bad choice, we lost them. It just breaks my heart. So it's really got to be a heavy focus on folks who are really trying to get into recovery, that we are there with them and support them, and more importantly, be there around them and look for things that might be going on. They're not acting right today. Something's a little bit off with somebody, and keeping an eye on those folks because it's a very, very high risk population. Some of those risk factors there, prior overdoses. Every time we have an overdose, we're damaging these receptors in our brain, all right? And so it makes us more susceptible to continue having overdoses. Every time you have an overdose, we're causing damage to our body and our organs. So it's just, just keep that in mind. Prior multiple overdoses can lead to continued multiple overdoses. Polysubstance use, that's the mixing of drugs together. And I can tell you when a combination that I don't like to see out this way is when I hear folks that are actively using fentanyl, benzos, and alcohol together. Those of you who don't know, benzos are benzodiazepines, often prescribed for a variety of disorders. Could be depression, PTSD, anxiety, and when taken as prescribed can be effective for a lot of folks. However, they're often highly abused. And the problem with mixing all three of these together is that they're all going to do basically the same thing, suppress your respiratory system, they're just going to do it in different ways. So that's a very, very deadly combination when you put all these three together. And again, like we mentioned, the drugs of the streets, they're unknown. We have no idea what's in that. And I think it's important to say this because you have a whole category of stimulant-only users. All right, those are folks that are strictly using methamphetamine, cocaine, crack. These are just stimulants, and so there's no opiates in that. However, you get drug dealers now mixing drugs and selling a variety of drugs. There's that risk of cross-contamination. And so we always really keep a close eye after our stimulant users out here who are active, and to be constantly wary of the drugs that they're buying, because it can be very, very dangerous out there. So that's some of the risk factors of an overdose. So we talked about the drugs. I've talked about what's actually happening in an overdose, and we talked about those risk factors. I want to get into a couple different scenarios here today for you, and how we respond to those scenarios. Let's say scenario number one, you walked into a place today and you saw a male on the ground. You don't even know his name. You don't even know if he uses illicit drugs. You just know that this guy's in trouble and you want to try to help him. I mentioned before, the faster we can assess this, the faster we can react, the better chance we have to save this person. So, if you walk into a room and you see this person down and you really have no clue what's going on, as I'm walking towards them, I'm looking for some stuff here, okay? My first clue that this might be an overdose is paraphernalia. And if you're walking in and you're seeing paraphernalia, and that could be anything from drugs to tinfoil spoons to syringes, straws, anything, it's probably a good likelihood this is drug-related event. As I walk towards this person, I'm going to take a look at their skin. Somebody in an overdose is going to have a complete lack of pigmentation. And we find that if you have a darker complexion, you tend to be ashy or gray color. And if you have a lighter complexion, you tend to be white or blue color. But it's going to be a total lack of pigmentation. Typically, they're going to be sweaty or clammy to the touch. They could also be sweating profusely. If their eyes are open, I'm going to look at the pupils. They're going to be what's called pinned out, very small or constricted. Anybody using opiates or any kind of opioids is going to have very small constricted pupils. And a real good telltale sign that this is probably an overdose is I'm going to look for lips and fingertips, dark blue, purple. And the reason that's happening is because the respiratory system is slowing down, therefore your blood circulation is slowing down, and your blood's collecting in those fingertips and the lips. So again, these are just things as I'm looking at, as I'm trying to quickly assess this scene as fast as I can. The definition of an overdose is defined as when a person is unresponsive and has reduced or stopped breathing. This is the true definition. So I want to try to assess this person to see if this could be an overdose, okay? Let's start with unresponsive, right? I need to see where this person is at. So I'm going to do two types of stimulation. One is going to be a verbal stimulation, and the other one's going to be a physical stimulation. The verbal stimulation is going to be just the way it sounds. I'm going to talk real, real loud. I'm going to get right down the ground and really make sure, see if they can hear my voice. I'm looking for any indication that they can hear what I'm saying to them. What we like to say when we respond to an overdose, I like to use the word Narcan, and as I would say something like this: hey, are you okay? Are you all right? I'm going to use Narcan. I have Narcan. If they hear the word Narcan, it's usually a good indicator. Nobody wants to hear the word Narcan if you're using illicit drugs, because it's going to, one, take away their high and all that. So if they can hear that Narcan, I'm hoping they jump up and say, no Narcan, I'm all set, I don't need Narcan. But if I do that verbal stimulation and I get nothing back, they don't nod their head, they're not looking at my eyes or anything like that, then I'm going to go right to a physical stimulation. That's going to be a sternal rub. You can take your knuckles, make a fist just like that. You have your knuckles, and you're going to find the person's chest here. The breastbone meets right between the breast, right over the breastbone area. And you're going to take those knuckles, you're going to press down and rub real hard and fast, okay? This is uncomfortable. It's supposed to be. Again, I want this person to really kind of jump up and say, ouch, stop, quit it. What the heck are you doing? But if you do that physical stimulation and you're getting nothing back from that person, then you've already assessed them. They're unresponsive, okay? They're unresponsive to a verbal and physical stimulation. Let's go to the second half of that definition, and it's reduced or stopped breathing. It's probably the most important part. We know what's happening in that overdose. It's a lack of oxygen. So I need to see where this person is at with their breathing. So we're going to do one move, but I'm going to do three things at the same time. I'm going to get right down close to their nose. I'm going to take my ear and put it right to their nose, and I'm going to listen. Look, listen, and feel, okay? So as I got my ear down on their nose, I want to look down that chest. I'm looking for their chest to rise, right? That's a clear indication that this person is taking breaths. Next thing I'm going to do is listen. A lot of times in an overdose, those opiate receptors are getting suppressed, the respiratory system is slowing down, and this person is now struggling to breathe, right? And it can be a very loud kind of noise, a snoring, a gargling kind of sound, and that's what I'm trying to listen for. And the last thing I'm going to try to do is feel. I'm going to try to feel air come out of his nose and actually touch my ear. And what I'm looking for is I need him to take at least one breath every 5 to 10 seconds. This is an absolute minimum. Let's say for this scenario, this guy is taking 1 breath every 5 to 10 seconds. I've already assessed him. He's unresponsive and he has reduced or stopped breathing, right? The first thing I gotta do is call 911. This call has got to get placed as fast as we can. Every second is gonna count at that point. When we're calling 911, we got to be careful what we're saying out here, okay? I want you to be very specific on the address, the location. Let's not make fire EMT search for anybody. We give them, if I'm on the 3rd floor, back door, it's a greenhouse, I got flowers, give them as many details as you can because we want to get them as fast as we can. And when responding to an overdose, basically tell them, hey, I got a male down, he's unresponsive, he has reduced breathing, please hurry. You do not need to mention that you think this is a drug overdose. You don't even need to mention the word drugs. Drugs are irrelevant at this point. He is unresponsive and has reduced breathing, period. I mean, if you call the 911, they're coming every single day of the week to try to help this guy. So again, just keep it real simple, the location, the male or female, unresponsive, breathing or no breathing, and try to get them there as fast as we can. Now that we called 911, I want to talk a little bit about Narcan, because I think this is an overdose. At this point, I happen to have Narcan on me, and I want to give this guy Narcan and try to save his life. I'm going to talk about Narcan for a couple seconds here. Narcan is what's known as a true antidote, and what that means is that the only thing Narcan is going to do is reverse an opioid overdose. That's it. It's going to do nothing for a cocaine overdose, alcohol, methamphetamine, benzos. In fact, if I give this to somebody and they're not in an opiate overdose, it'll have no effect on them whatsoever. It's safe for men, women, children, pregnant women. Anybody could be administered Narcan. It's not addictive. It's very simple to use, all right? The way to administer Narcan, well, actually, let's back up. How Narcan works. The way Narcan works, when I administer it to that person, it's going to travel through their nose. It's going to absorb through their mucous membranes, through their nose, and go to their brain. And what that Narcan is going to start to do is find the opiate receptors in the brain, and it's going to find those opiate molecules that are attached to them and dislodge the molecules from the receptor. This is going to usually lead to that person becoming responsive and their breathing, starting normal breathing to start back up. What's important to remember about Narcan is it dislodges the molecules from the receptor, but it does not flush that from the person's body. In fact, those molecules will still be in that person's brain. They're just kind of sitting there waiting until that Narcan wears off. And when it does, they are going to try to go back into those opiate receptors, which would cause them to go right back into an overdose. Narcan only lasts 30 to 90 minutes. And again, this is very important too, because if this person does become responsive and they're breathing and everything's all right and they refuse medical attention, after 90 minutes and the Narcan wears off, let's not forget, those molecules are still in the brain and they go right back to those receptors. And if they do, they're at risk of an overdose. So it's like, if we're still with that person and they refuse the medical attention, we need to try to stay with them as long as we can, just in case they do go back into an overdose. A few things to remember about Narcan: it's temperature sensitive, 59 to 77 degrees optimal temperatures. Doesn't mean it can't go lower and it can't go higher. It's just not for a long period of time. I get asked all the time, Keith, can I leave this stuff in my glove compartment in my car? The answer is no. We live in New England. These temperatures fluctuate way too much, so it's not a good idea. Narcan does expire. My Narcans we distribute out here in Northwestern County, they last about 2 years. And if you end up expired, we always swap them out for fresh Narcans. And Narcan is safe to administer if that's all you have. If your Narcan is expired and that's all you have, feel free to use it. It's still safe to administer to that person, just may not be as effective. You're not going to harm that person in any way. I will tell you that there's a next generation 2 Narcans that are soon to hit the streets. I believe in about 2 weeks or so. And you're going to know that they're new ones because they're going to have a little red trigger. And what they've done is they reformulated the Narcan now so that temperatures of the 59 to 77 degrees, they've expanded that way now. So these Narcans will be able to stay in temperatures above 104 degrees and as low as 5 degrees for 12 months at a time. The Narcan that we're going to start distributing also, you'll be able to, it can be frozen and thawed as many times as we can without losing its efficacy. So we got some good different Narcans coming down the pike, but just giving you an idea of what's coming down the line. So how do we administer Narcan? Narcan is very easy to administer. We call it the 3 Ps, peel, place, push. Every kit that we distribute through AIDS Project Worcester here looks just like this. It's going to come in a baggie. There's 2 Narcans in there. There's going to be a little instruction booklet, gives you a quick little resource guide, and of course some of our services we provide and access to that. But so the 3 Ps is peel, place, push. You take that first Narcan out of that bag, your first P is peel. You're going to peel that foil off the backside and get your Narcan out of the package, okay? The second P is place. I'm going to hold the Narcan, my 2 fingers up top, and my thumb's going to be on the trigger here, right? And what I want to do is place this tip into this person's nose. And I'm going to give you a little tip here. If you can, you want to tilt that head back, because if I tilt that head back, my Narcan is going to come in at a nice angle. If not, usually I'm trying to come in too straight. So you tilt that head back. I'm going to put this applicator into one nostril, get it in there deep. I want my 2 fingers to be pressed up against his nose, right? And that last P is push. I'm going to push this trigger. And when you push this little trigger, a little spray is going to be dislodged from the Narcan. It's going to go into the nose, absorb in the mucous membranes within a couple seconds, travel to the brain, and do what that Narcan's supposed to do. Narcan can take as little as 30 seconds to work. It could also take up to 5 minutes to work. What we recommend is waiting at least 3 minutes in between applying a second, a third, a fourth Narcan to this person. And the reason we do this is because Narcan is going to put a person in complete withdrawals very, very rapidly. And we find that if you administer Narcan too much too fast, while this person might become responsive, they're going to be in extreme withdrawals and really not in a good way. So we don't want to make it worse for this person if we can. We want to give the Narcan a chance to work. So what we want to try to do is administer these Narcans 1 every 3 minutes. And every time we administer a second or third Narcan, you just alternate nostrils. We're going to go left, right, and keep doing that. And I'm going to continue to administer this Narcan until 1, it becomes responsive, 2, I run out of Narcan, or 3, until 911 shows up. Let's talk about that second scenario. Let's say you walked into this room, you saw a male down, you quickly try to assess him. You do a verbal stimulation, a physical stimulation, he's unresponsive. You go down and check his breathing, look, listen, feel, except this time he's not breathing. First thing we got to do is call 911. We got to get that call out as soon as we can. Typically before COVID, we would recommend doing rescue breathing at this point. But now with COVID in place, DPH is advising that nobody is to do rescue breathing because it is a high risk of transmission from the victim to the respondent, from the respondent to the victim. So they're not recommending doing rescue breathing at this point, and they're recommending doing chest compressions. However, I still want to talk about rescue breathing real quick so people are aware of how rescue breathing is done and why it works so well. Why rescue breathing is so effective. If you think about that overdose, this person is losing oxygen, and I need to try to replace this oxygen. And there's no better way to do that than doing rescue breathing. Rescue breathing is very simple to do. It greatly reduces the irreversible damage to the brain. You know, lack of oxygen, this person goes too long without that oxygen, they develop brain damage and all kinds of adverse body effects. So we want to try to minimize that. So if this was not COVID times, we would recommend the rescue breathing. To do the rescue breathing, very simple. The first thing I want to do is look inside this person's mouth. I have to make sure there's no objects. The last thing I want to do is blow air into this person's lungs. And if there's anything in his mouth or his throat and it gets lodged in his windpipe or his lungs, I got big, big problems. So doing a mouth check is very, very important. The next thing I want to do is really get that neck back. And since a hand under the chin and the back of the head, and you're going to really tilt that head back. And all it's really going to do is going to open up their airway to the maximum amount that we could possibly get, right? So once we have that all down, I'm going to take my one hand and I'm going to squeeze that nose real, real tight, right? I'm going to take a deep, deep breath, and I'm going to go down and make a good seal with my lips onto their lips and blow a solid, sustained breath of air. Rescue breathing is very simple. It's 2 breaths to start, 1 breath every 5 seconds. Every time we put 1 breath of air into this person's body, we're giving him about 4 to 6 minutes worth of oxygen to sustain. So basically, if I have no Narcan on me and I'm doing rescue breathing, I already called 911, I can keep this guy alive just by keeping oxygen to his brain. If your brain gets oxygen, your brain will tell your heart to stop beating. If your brain stops getting oxygen, eventually it's going to tell the heart to stop beating. So that's why it's kind of so important. And I just think it's important that folks understand the rescue breathing piece so that eventually when COVID is gone, hopefully someday, this would be the go-to method in responding to an overdose. With rescue breathing, you know, a lot of folks I talk to, if they don't even know this person, they don't want to put their lips on that person's lips, this kind of thing. There's always barriers. I completely understand this, but there's always going to be a barrier. They sell face shields at like CVS and different pharmacies that you can put right near your keychain that you can use. If you don't have any kind of a face shield like that, you could also use your shirt. Your shirt will act as a barrier. Take your shirt, put it over that person's mouth, and that will limit that contact there. So please don't let that stop you from trying to help this person. So we talked about, like, you know, with the COVID now, and rescue breathing is not advised by Department of Public Health to be done at any time right now because of the risk of transmission. Chest compressions are the alternative to the rescue breathing to reduce that transmission. So to do chest compressions is very, very simple as well. Basically, you're going to take the heel, one of your hands, you're going to place it right almost the same spot you did the sternal rub, right between where the breastbone meets here. You're going to take one hand and you're going to place it down there. You're going to take the other hand and put it right on top of there. You want to get square over that person's body with your shoulders, and then you're just going to make chest compressions at a rate of 100 to 120 per minute. It's going to look something like this. And you're going to continue to do this until this person becomes responsive or until paramedics or 911 was to show up. Chest compressions work because you're going to be getting that oxygen and the blood flow to the brain. You're going to basically keep this person alive. And this is what the Department of Public Health is advising we do now instead of that rescue breathing as a safer alternative. So let's get back to that scenario. I got that person down here. I don't have any Narcan on me right now, and I've called 911. This person's not breathing. And I'm going to do chest compressions for a period of time. And I just remembered I got Narcan next door. There's somebody that's got Narcan down the street, and I want to grab that, but I have to leave this person alone. That's okay to do. However, you can never leave somebody alone in an overdose for a long period of time. If it's more than 30 seconds, don't leave them alone without putting them in a recovery position. The recovery position is very, very simple to do. That person's laying down. I want you to take their left arm, put it up over their head. You're going to remember the left arm because the heart's on that side. You're going to take that right leg and start twisting them over to their side. And you can see just like on the diagram there, take that one knee and kind of lay it up. What's that going to do basically is prevent them from rolling on their stomach and rolling on their back. And the reason we do this is because a lot of times in an overdose, vomiting does occur. And the last thing we want to do is have this person on their back and have that occur. So the recovery position is very, very easy to do. It can be done very quickly, and it's very, very important that we put them in that position if we have to leave them for any bit of time to go grab that Narcan. The Department of Public Health is also advising if you have the means to, at the time, if notices an overdose, if you have the chance to get any kind of PPE, that's going to be your N95 mask, face shield, gloves, gowns. They're recommending having them, that you wear these when responding to an overdose to try to reduce that risk of transmission as well. Either way, no matter what scenario you had with or without Narcan, it basically coming down to accessing this person as fast as we can, calling 911 and getting that call as fast as we can, and trying to do anything that we can to help this person, whether it's just administering Narcan, whether it's rescue breathing if there wasn't COVID-19 times, or if it was chest compressions, anything that's going to help this person stay alive until paramedics can get here and try to help them. I want to talk a little bit about the Good Samaritan law in Massachusetts, and I think this is important because the Good Samaritan law in Massachusetts states any person that acts in good faith to assist somebody in an overdose is protected. And what you're protected from is administering Narcan. You're not going to be held liable for administering Narcan to anybody. You're protected from doing chest compressions and doing rescue breathing if you were doing that. You're not going to be held liable. What you're not protected from in a Good Samaritan law is a warrant. And out in the streets, when I do a lot of street outreach out here, a lot of folks know I don't care about people's warrants. That's got nothing to do with me. I don't want to see anybody get jammed up on a warrant, but I do want to see them try to help that person. So like if you had a warrant and you had your friend had an overdose and you don't want to subject yourself with law enforcement, I'm asking you call 911, give them the exact location of where you are, administer your Narcan if you have it, and then get out of there. Don't put yourself in that position. You're not protected from large amounts of drugs on your persons. You are protected from a simple possession charge, small amounts in paraphernalia. But if you have large amounts, you're not protected in that scenario. And also, if this overdose occurs in an apartment or residence where children are present, DCF is going to be called that night. You are not protected. And I think that's very important to know. You have to be very careful about who you're allowing in your home and what they're doing in your home. Because you may not do drugs whatsoever, but you have somebody in your house who does use drugs and they overdose and the cops are called. There's a good likelihood, and you have children, DCF is going to be called. So it's very important to just keep these things in mind and where we are and where we're not protected in the Good Samaritan law. So, as promised, I wanted to show you a couple ways to get Narcan here today. As many people know, there's a standing order at most pharmacies throughout Massachusetts for Narcan. You are going to have to present your insurance, and there might be a copay. If you have Mass Health, it's a $3.65 copay. If you have particular types of Mass Health, it's a free. It costs you nothing. So if you don't want to go to the pharmacy or go through your insurance company, you always can call AIDS Project Worcester. Certainly if you live in the city of Worcester, there's that number on the screen right there. If you're out here in North Worcester County, towns like Leominster, Fitchburg, Gardner, Westminster, Athol, Orange, Winchendon, all these areas, call me. My cell phone's on there. Give me an email. If you want a training done at your particular facility, you have a halfway house, sober home, and I'm not going to right now, please call me. Let's schedule. Let's get people trained, and more importantly, let me get Narcan into your house. In Fitchburg, Restoration Recovery, they have Narcan available probably 5-6 days a week at this point. Up in Gardner area, Lissa's Place, Recovery Center, you can get Narcan up there just about 5 or 6 days a week as well. So again, there's lots of places we can get Narcan, and if you're still having issues or struggling to try to find it or get it, please call my cell phone, please email me, and certainly any opportunities there are out there for me to get this information out and get you Narcan, please don't feel free to reach out to me. Some of the other services we're providing right now through AIDS Project Worcester, rides to detox. If you need a ride to detox, and that can be anywhere in Massachusetts, call that number and we're going to get you for free. We're going to get you transported up there. And that is specifically for Worcester County, City of Worcester residents. We currently don't have that service available in North Worcester County, but we are working on something for the near future. Like I mentioned before, if you need to obtain clean syringes or clean equipment, please call the number on that screen right there, and feel free to visit our website as well to see all the services that we provide to the community out here. So I hope you enjoyed the presentation here today. As mentioned, please feel free to reach out to me with any questions, any concerns. You need help in this area, you need Narcan, you need anything out this way that's addiction related, please call me, please email me, because I am here and ready to help in any way we can. You know, as we observe this Overdose Awareness Day, and we remember all the folks that we have lost out here, our friends and our loved ones and our family members, and to date, I've lost 19 friends to this disease, and that goes back over a period of 20 years. And I can tell you, these folks were funny, they were caring, they had huge hearts, they were intelligent, they were talented, they were motivated. I knew them way before drugs even came into their lives, but at some point these drugs entered in. And these drugs are incredibly powerful, and they can instantly start to, alter that person's brain chemistry and their thinking. And that risk versus reward mechanism that we all have gets really, really out of whack. Remember that these are good people. They're just making bad choices. And it doesn't matter how they got into this, what their particular scenario was. They're people at the end of the day. There's a word I don't like to use out here, and this is the word addict. Nobody wants to be called an addict. An addict has such a negative connotation to it. And really, these are not addicts. These are people that are struggling with a substance use disorder. All right? And just keep that in mind. That is somebody's son or daughter on the ground. That's someone's mother or father. And try not to be so judgmental. You know, when we work with folks out here, I kind of stick to the same kind of mantra that I usually like to follow. What it says is, when treating people, when trying to help people, don't treat them for the way that they may appear. Treat them the way you know they can be, and that's what they'll become. And I really, really believe that. These deaths are preventable. Every overdose is preventable, but we need to be there. Someone needs to be there and know what to do with or without Narcan so we can save lives. Everybody has a chance to recover, but if we lose them to an overdose, there is a 0% chance of recovery. And we don't want to lose anybody else out here. So it's time to really kind of put our foot on the gas. We got a pandemic and an epidemic at the same time. We must not lose sight of this epidemic and keep an eye on our loved ones and keep them safe and try to find the pathway that's going to work for their recovery. I hope you enjoyed my presentation. God bless. Thank you.